The Eastern Cape is battling several challenges as COVID-19 infections continues to rise, and hospitals are full and there's a shortage of staff, we're told. Health Minister Dr. Zweli Mkhize is in the province today assessing how two hospitals in the Nelson Mandela Bay Metro are coping. Lerato Fikise is our reporter covering this story. Lerato, very good morning to you. Firstly, I just want to talk about the person that Minister Mkhize appointed to set up this project unit team to deal with all the health-related issues during this pandemic in your province. Tell us more.
Good morning to you, Blaine. We're now broadcasting outside Livingston Hospital, where the Minister of Health is going to do a walkabout. Like you said earlier on, that he did appoint a man to come and overlook the health issues facing our province. And if you remember, just a few weeks ago, this specific hospital, Blaine, which is Livingston Hospital, a quarantine hospital, has been one of the issues that are highlighted in the media. We saw a BBC coverage where they highlighted issues of shortages of PPEs, staff shortages, doctors having to clean and mop and also take care of patients at the same time due to a shortage of staff. And I think, like the MEC of Health said earlier on, that because of this bad publicity in the press right now on social media, they felt that it's important to come down to the metro and actually find out what are the real problems. And I must highlight, Blaine, that although the BBC did highlight how bad things are, things since then have improved. And I think it's important that as we highlight the plight of the hospitals, that we also strike a balance to say, yes, there is a problem, Blaine, but equally so things are being done to address this. What was interesting, Blaine, yesterday when the MEC of Health was actually speaking to the union, was that she was saying that in the various hospitals that she has been to, which is Doranginza, which has also been in the media for all the wrong reasons. Remember that 2 or 3 weeks ago, there were images circulating on Twitter where we saw people lying on the ground, corpus on the ground, also the casualty and maternity ward also in dire stress. And we saw also then the Department of Health deploying more staff to the hospitals, and things there have improved as well. And we have also heard the MEC of Health saying that she's actually quite happy with the state of hospitals and how they're currently running, and saying that obviously there is a need for more staff to be employed. But what's also interesting, Blaine, is to hear what the union was saying. They were saying, if anything else, what she's saying is not true. What's happening on the ground is that there isn't enough staff, people are getting infected, staff members are dying at a rapid rate, and there is no good communication between them and the department. I actually do quote House Secretary Sweetness Stokwe saying that she would actually like the Department of Health to totally be disbanded and to start again, because she says they are failing the Eastern Cape at this time where they need to step up. Interestingly so, also what we found out yesterday through our talk with the MEC of Health is that there's been an issue of the number of deaths that she, through her talks yesterday, found out has not been properly recorded. So she says that in the past 2 weeks, the numbers, especially here in the Nelson Mandela Metro, are not a true reflection of the number of people that have died due to COVID. And there's currently an investigation being done to find out exactly why were the numbers incorrectly captured. Secondly, and she said that she's going to make sure that those who have committed the error are given the consequences due to them. So it's going to be interesting, Blaine, to hear exactly this afternoon when the minister comes to this hospital, is he going to find the same issues that we saw in the media a few weeks ago? Is he going to find incompetence? Is he going to find doctors sweeping, mopping, yet still taking care of patients? Or is he going to find a situation like MEC of Health has said has turned around? So he's going to do a walkabout at this hospital, and above all, he also wants to talk to unions who are saying, you know what the media is being shown, the state of hospitals, the dire strait, is a true reflection of what is happening. And what the Department of Health is saying, that things are good and fine, is not exactly what's going on, because the state in hospitals is really as bad as it's seen in the media.
Right. You know, we know that oxygen is so important in terms of first-line treatment of COVID-19. I was just looking at my notes from yesterday's briefing by the Eastern Cape Premier, talking about oxygen storage in Nelson Mandela Bay, and they're trying to distribute all this to all the 19 district hospitals. What are you hearing? How big of an issue is oxygen supply in your province?
2 weeks ago, Blaine, I got the privilege of sitting down and having an interview with Dr. Thobela, who is a medical doctor in the ICU facility where they use oxygen the most during the COVID-19 pandemic. And she said one of the problems they are facing, like you just said right now, is the issue of oxygen. It's got so bad, Blaine, that when a patient comes in, she has to decide, just based on her sensitivity, who among these patients is fit enough or must get a ventilator. So she was saying it's so bad that she has to decide, you know what, this one must get one, this one mustn't get one, based on the severity of their symptoms. So we are aware that specifically at this hospital where she is working, there is a dire need of ventilators, because at this time ventilators become a critical part and play a critical part in restoring oxygen in the inner parts of people as they struggle with breathing problems as they try to fight this pandemic. So I think you're right, Blaine, in saying that there is a dire need for ventilators, not only in other parts of the Institute, but particularly this hospital right here, right now, which is housing a lot of patients with COVID-19 and is due to house more, because we're also aware that there's 11 million rand renovations currently being done at this hospital to cater to 72 more COVID-19 patients. So as more COVID-19 patients come here, there's going to be an increased need to supply ventilators, and I think it's important that the Department of Health makes these available.
All right, Lerato Mkhize, thank you very much indeed for your reporting. We'll come back to you when the Minister arrives.